Good afternoon to members of the public and members of the media. Let me first begin by thanking my predecessor, the Most Honorable Lieutenant Colonel Jeffrey Bostick, for his sterling leadership of the Ministry of Health and Wellness, and especially his leadership during the COVID-19 pandemic. Let me also thank the several healthcare professionals and frontline workers who continue to help us during this critical period. My purpose at the media briefing is to introduce myself as the new Minister of Health and Wellness. As you know, I will be supported by my Minister of State, Dr. Sonia Brown. As you would appreciate, the Ministry of Health is a very expansive ministry, and I'm still taking briefings from the technical team within the ministry. However, questions can be directed at the Chief Medical Officer, Dr. Kenneth George, Dr. Clyde Cave, Director of Medical Services at the Queen Elizabeth Hospital, and Dr. Adana Granison. As we continue to monitor and respond to the current surge in COVID-19 cases and simultaneously move towards economic recovery, it's important to recognize that our relative success in managing this pandemic is due to the government's swift yet decisive actions in implementing preventative and protective strategies such as testing, social distancing, mask mandates, and vaccination. We have managed the Alpha, Delta, and now the Omicron waves, and we fully intend to do the same with the latter. At this halfway point in the Omicron surge, the Ministry of Health and Wellness continues to focus on expanding our laboratory capacity, self, home, and institutional isolation, non-pharmacological measures for infection prevention and control, and the promotion of the national vaccine program. We believe, based on current internationally accepted science, boosters offer the best opportunity for reducing severe infections, hospitalizations, and saving precious lives. And we are in the fortunate position in being able to provide such boosters to the Barbadian public. We have unfortunately lost 277 lives, and this represents a case fatality ratio of 0.9, which is indeed lower than all small island developing states, which is currently at 1.5%, and the global average of 2.2. Home isolation and home quarantine will therefore continue to play a critical role in managing the pandemic, with emphasis placed on managing ill persons and those at risk for severe outcomes such as the elderly and those with non-communicable diseases. I wish to caution the public that this health crisis is not yet over, and I therefore urge all Barbadians to continue to faithfully follow the universal precautions against COVID and the measures that have been put in place to safeguard us against this severe disease and death. I will also assure the nation that as Minister of Health and Wellness, I will continue the ministry's agenda for non-COVID healthcare such as mental health reform, non-communicable diseases, climate change, enhancing primary healthcare delivery, environmental health and vector control, promoting a good working environment, promoting policies and programs to support the healthy lifestyles in all sectors of our community, and improving operations of the polyclinic, the psychiatric, the geriatric, and Queen Elizabeth hospitals. We have already demonstrated our clear resolve to see this pandemic through. In relation to the COVID directive, the sole change will be the resumption of in-house dining in restaurants, providing that all infection prevention and controls are in place. The current directive expires on Monday, and the new COVID directive will be for 2 weeks. It is an undoubted honor to be given this ministerial responsibility for health and wellness. In carrying out my duties, I will of course build up the strengths and good work of my predecessor, the Most Honorable Lieutenant Colonel Jeffrey Bostick, and the experience and expertise of the professionals within the ministry. I will also have the benefit and guidance of the Most Honorable Senator Dr. Jerome Walcott, Senior Minister with responsibility for my ministry, and Dr. Sonia Brown, an accomplished medical professional in her own right. My approach to my new duties as Minister of Health and Wellness will be influenced by the management techniques and commercial skills gained from the private sector from which I came to government. These factors went a long way in helping me bring about improvements enjoyed by the public in my previous assignment as Minister of Transport, Works and Resources. I thank you.